Nursing homes in Texas haven't had a decent increase in what they're paid for the care they provide in almost 20 years. But while the funding gap is getting bigger, the real issue is the effect on quality in ensuring that seniors in Texas have the available services and care they deserve. This current trend is simply unsustainable, and we are seeing nursing homes close, as well as indicators of large-scale risk for closure. It's becoming the norm to underfund nursing home care in Texas, and we must change that. Since last session, when we came as close as we've been in years to passing an increase, we have worked to ensure that we don't lose that momentum. We have continued meeting with legislative leaders, and they seem open to a solution, but want to see quality improvements for any increase they agree to support. So, in response, we're working with legislative leaders on the Texas Nursing Home Quality Act, or NHQA, a program that will close the funding gap, give legislators the quality-based payment programs they're wanting, and provide nursing home operators like you the resources to make investments in people, into better programs, and improved facilities so that we can better care for our residents. The NHQA is similar to the provider assessment model that 44 other states use to supplement nursing home funding. It allows us to draw down available federal funding for long-term care that is currently not being utilized by Texas. We believe the NHQA will satisfy the expectations from legislators by proposing a bill that is 100% dedicated to quality. 50% of the funding will be committed to infrastructure and process needs, to improve care delivery like building and equipment improvements, staff wages and benefits, and innovative care delivery programs to improve the overall resident quality of life. The other 50% will be dedicated to meeting quality outcomes, improving staffing enhancement programs, and directing additional dollars to patients with Alzheimer's disease or other cognitive impairments affecting those living in long-term care facilities today. And all of this will be done without expanding Medicaid and without adding to our state's budget, a solution that has zero cost to the state. The Nursing Home Quality Act also recommends an advisory committee comprised of providers and advocates to provide insight and recommendations as to how quality outcome dollars should be prioritized. This is also a bill about personal responsibility. As in the other 44 states, nursing homes will pay an assessment that is expressly prohibited from being passed on to their patients. This assessment will serve as the state's share to draw down federal dollars that are currently helping pay for long-term care in other states, but not right here in Texas. Roughly, for every dollar that the state commits, the federal government will commit $1.50, meaning that for every dollar invested from the state program, the state will receive $2.50 to fund Texas nursing homes. Nursing homes will see their investment return through increases in the Medicaid rates that they receive to care for the patients they serve. Legislators like the commitment the Texas Nursing Home Quality Act makes to improve quality for care for Texas seniors. And we believe this may be our best chance to close the funding gap for the foreseeable future. We will continue to refine the proposal to ensure that it is in the best interest of our industry and those that we care for. But we must seize upon this opportunity or lose the chance to significantly increase funding for Texas nursing homes. And we need your help to make this become a reality. The Nursing Home Quality Act, or NHQA, is a program that demonstrates a commitment of personal responsibility from the nursing home providers through provider assessments serving as the state share. NHQA is a commitment to quality by directing quality dollars towards capital improvements, wages, benefits, and other direct care services to improve upon the overall quality of life for our residents. Through quality-based payments, the NHQA rewards those providers who are able to demonstrate that commitment. But your legislators need to hear from you. You are their constituents, their neighbors, you are their friends, and you are those that elected them to serve in your interest. If they don't hear from you, they are less likely to understand and appreciate the challenges you face on a daily basis. You will soon receive an email asking you to sign up to send a message to your legislator. Some of you will be asked to be part of a team to meet with your legislator. Bottom line, your involvement is critical to our success. We will provide you materials and talking points and specific guidance on how you can easily step forward to help us increase our legislative support for long-term care in Texas. We have worked hard to position our industry to succeed this legislative session. Help us close the deal for your staff, for your buildings, but most especially for the special individuals that you care for on a daily basis. So look for an email from me asking if you're in. Your participation will be easy. It does not take a lot of effort or time, but it could dramatically change the state of long-term care in Texas. It's my hope that you're in, and I hope that we hear from you soon. Thank you.